Before doing suctioning, it is not necessary to A. Check the temperature, B. Auscultating lungs sound, C. Wash hands, D. Check SpO2 probe. And the correct answer is A. Check the temperature. Except checking temperature, all options like auscultating lungs, washing hands, checking oxygen saturations are essential before suctioning. Nurse engaged in suction process of tracheostomy in situ patient who requires frequent suctioning. How long she should do suctioning every time? A. 3 seconds, B. 10 seconds, C. 5 to 10 seconds, D. 10 to 15 seconds. And the correct answer is C. 5 to 10 seconds. During suctioning, patient may become apneic since the air from lungs also suctioned and patient also hold breathing during suctioning, which may lead to cardiac arrest. So, never suction longer than 5 to 10 seconds at one time. For tracheostomy patient, how often suctioning should be done? A. As desired. B. As needed. C. Every 1 hour. D. Every 2 hours. And the correct answer is B. As needed. Frequency of suctioning secretion from tracheostomy tube should be as needed and hyperoxygenate the patient before suctioning. The nurse is doing endotracheal suctioning. During the procedure, the nurse notes decreased heart rate on the monitor. What should the first priority action? A. Stop procedure and oxygenate the patient. B. Ensure that suction is limited to 15 seconds. C. Notify the physician immediately. D. Continue the suctioning. And the correct answer is A. Stop procedure and re-oxygenate the patient. During suctioning, patient may become apneic since the air from lungs also suctioned and patient also may hold breathing during suctioning, which may lead to bradycardia and cardiac arrest. While suctioning tracheostomy, the nurse must remember that it is important to A. Initiate suctioning as the catheter is being withdrawn slowly. B. Insert the catheter until cuff reflex is stimulated. C. Untie the neck tape while suctioning. D. Give 100% oxygen before suctioning. And the correct answer is D. Give 100% oxygen before suctioning. Give 100% oxygen before suctioning because suctioning may cause hypoxia and cardiac arrest. What is the purpose of cuff in endotracheal tube? A. To prevent dislocation. B. To make radiological location easy. C. To avoid damage to the trachea. D. To provide airtight seal in trachea. And the correct answer is D. To provide airtight seal in trachea. The cuff of endotracheal tube is designed to provide airtight seal within the airway. It is allowing airflow through the ET tube and preventing air and fluid aspiration around the ET tube. A nurse assisted in endotracheal intubation. The doctor advised to maintain cuff pressure between 20 to 25 mmHg. What is the complication of low cuff pressure? A. Risk of aspiration pneumonia. B. Tracheal bleeding. C. Ischemia. D. Pressure necrosis. And the correct answer is A. Risk of aspiration pneumonia. Endotracheal pressure measured by aneroid pressure manometer. Low cuff pressure may increase risk for aspiration pneumonia and high cuff pressure may cause tracheomalacia. Tracheomalacia is tracheal dilation and erosion cartilage due to constant pressure of cuff. Appropriate size of endotracheal tube used in adult is A. 2.5 to 4 mm, B. 8 to 9.5 mm, C. 5 to 7 mm, D. 4 to 4.5 mm. And the correct answer is B. 8 to 9.5 mm. Appropriate size of endotracheal tube is according to the age are newborn infant 2.5 mm to 4 mm, 0 to 1 year 4 mm to 4.5 mm, children up to 10 years 5 mm to 7 mm, children above 10 years 7 mm to 8 mm, adults 8 mm to 9.5 mm. Guedal airway is A. Oropharyngeal airway, B. Tracheal airway, C. Nasopharyngeal airway, D. Laryngeal airway. And the correct answer is A. Oropharyngeal airway. Guedal airway is an oropharyngeal airway, also known as oral airway. It is a curved plastic tube used to establish an airway in patient's mouth by displacing the tongue. It is used to maintain or open a patient's airway. A patient in the emergency department has an endotracheal tube in situ and is on ventilator. Now, situation is that the patient has pulled the tube out of his mouth. What would be your next step? A. Apply face mask with high flow oxygen. B. Sit the patient up and consider chest physiotherapy to get the secretion out. C. Reinsert tube immediately under sedation. D. Pull the tube completely, beg and mask the patient and assess spontaneous breathing effort. And the correct answer is D. Pull the tube completely, beg and mask the patient and assess spontaneous breathing effort.